Yes, hello everybody, and a very warm welcome to the third webinar in our mental health dialogue series, which focuses today on how to reach vulnerable groups in research, a really very relevant and important topic. My name is Benedikt Amann. I'm principal investigator of the Mentbest project in Spain and director of the research unit at Centro Forum, which is Hospital del Mar in Barcelona, and I'll be your moderator today. Just to start a little bit about this really important topic, mental health is critically important to everyone, everywhere. As public health professionals and researchers, we are aware that obviously barriers exist in accessing available resources. It is our responsibility to identify these barriers and work to improve access, ensuring that as many people as possible can benefit from our interventions. To assess the real-world impact of interventions, it's crucial to include the entire community, including individuals with diverse needs. To achieve this, it is essential to identify vulnerable groups and measure their specific characteristics and understand how to adapt interventions effectively. But now that the important point is, what are we talking about really when we say vulnerable groups? So this will be maybe a part of the discussion today as well. In my understanding, vulnerability refers to how susceptible a population or an individual is to harm or neglect, influenced by both inherent risk factors such as age, sex, and race, and acquired risk factors such as health, behaviors, environmental factors such as psychological trauma. Vulnerable populations are those at higher risk for poor physical, psychological, or social health, with these challenges exacerbated by social, economic, political, and environmental factors. By exploring the peculiarities of vulnerable groups, we can examine the intersection of cultural, social, political, and economic factors and how they influence public health research. This enables mental health researchers to identify points to convergence and make our research more inclusive and global. So we're really very, very happy to have you join us for this important discussion organized by the 7th EU Horizon Europe projects under the European Commission's call for boosting mental health in times of change. These 7 projects, Advance, Smile, Mentbest, Reconnected, Improva, BootStRaP, and ASPbelong, are all powered by the European Health and Digital Executive Agency. And it's very important to bring them together and to have a transversal view on the projects and issues which were discussed in our series. The Mental Health Dialogue series is a space where researchers, practitioners, policymakers, and of most importance, end users come together to discuss the latest trends, challenges, and advancement in mental health care. In today's editions, we will now explore how to reach different vulnerable groups. Each project identifies specific vulnerable groups that they aim to engage with. But what do we mean, again, by vulnerable groups? Why is it important to focus on these groups when planning and implementing a project? This is something challenging we are all facing across the 7 projects and what we can discuss today. These are key questions that will guide our discussion today, understanding who these vulnerable groups are and why they are at a greater risk, helps us tailor more effective and inclusive mental health interventions. Today, we will try to answer all these questions. The webinar format is ideal for this, as we will not have formal presentations, so it's less boring, it's more interactive. Instead, we will engage in dynamic and interactive discussions. Provocative questions will be posed to our esteemed panelists and to you, all the participants. Yes, we encourage you very much, your engagement. You can all contribute and obviously share your insights and inquiry using the chat or the question and answer tool in Zoom. With that, let me give you a brief overview of our program for today. So first, we will start with the webinar with an opening speech by Professor José Luis Ayuso Mateos. Following that, we will have the lightning talks, where each project will explain to us their target vulnerable group and discuss why they consider this group important in the development of their projects. This will be followed then by a moderated discussion by myself, during which we'll focus on the challenges identified by each project, the solutions being implemented to reach young people and other vulnerable groups, and the importance of collaboration with individuals who have lived experience of mental health conditions and how their collaboration plays a crucial role in the design and implementation of effective strategies. We will then open the floor to question and answer session, where we will address your questions as well, obviously. And finally, we will conclude with a closing message announcing the series and providing the global registration link for your mental health dialogue series. With that, I would say let's get started, and I'm really pleased to invite our first speaker, Professor José Luis Ayuso Mateos de la Universidad Autónoma de Madrid, to deliver the opening speech. José Luis, just to mention this briefly, is a professor of psychiatry and director of the Collaborating Center of the World Health Organization for Research and Training in Mental Health Services at the University Autónoma de Madrid. So, José Luis, the floor is yours.
Thank you very much, Benedict. You can hear me well? Okay, so thank you very much, Benedict, for the introduction, and congratulations for the organizer of these webinars, and particularly thank you very much to Kerry for this very effective organization process of this complex webinar. Yes, I'm just here just to give you some brief reflections coming from my experience as a researcher working in the area of epidemiology and also adapting interventions. More than 25 years working with the WHO in areas related to the assessment of the burden of disease, the assessment of the impact of population-level interventions on the burden of disease, and also on the development of guidelines, of management guidelines for different disorders. But also reflection coming from my day-to-day work as a clinician, working in Madrid with mostly adult patients, but I'm also involved now as a head of a large clinical department of trying to organize the community mental health services and trying to have a population perspective in trying to organize these population services. No, it is clear for me that and for everyone probably connected to this webinar, that we have a lot of interventions in mental health that work, that are very effective, particularly we compare with many other health interventions, and many of them are cost effective. However, despite this evidence that we have tools to manage mental health disorders, there's a huge treatment gap. I mean, there's a large percentage of our populations that do not benefit from these interventions. And that is so everywhere, but also includes countries like the one represented within this webinar, countries that have universal coverage that includes mental disorders, accessible, free, with large and very well staffed or trained primary care services. And despite that, conditions in Europe, in many countries in Europe, the treatment gap, for example, for conditions like depression is 50%. And also, and this is something that we experience every day in clinical practice, but also the epidemiological studies also reveal that those that could benefit more from our interventions are less likely to receive them. So there's not only there's a treatment gap, but also the treatment gap left large percentage of people with morbidity in the general population that have severe cases, and that's something that should be taken into account in planning any mental health policies. It is the most vulnerable population that have more health morbidities, and when I'm talking about health, I'm talking about physical health and mental health, and then also that they have less access to service. What do we need to do? And of course, there are activities that connect with aims of all the projects that are being presented here. No, we need to assess the impact of these inequities and factors of vulnerability, like poverty, like racism, like discrimination in health problems, and also in its management and its policies. We need to develop, we need to adapt effective interventions to these vulnerable populations, specifically targeted them. And then in this process of development and adaptation, we need to involve them. We need to engage them as co-creators, as elements that will be key in trying to address all these implementation problems and challenges that we have. And for that, we need an implementation framework in the assessment of these interventions that takes into account what are the barriers, what are the facilitators, and what are the many factors that really influence the adaptation of these interventions on large-scale implementation of effective interventions. But then there's something that at the same time that we conduct research, that we collect evidence supporting that what we do is something effective. We also need to engage and formulate policies and guidelines and be sure that we have and we collect the proper elements in our research that will help in trying to sell what we do to those that need to take decisions at the policy level, high level, but also at the local district level. And this is something that I'm sure many of the projects involved have always in mind. But also, I'm an academic. I'm very much involved in research for years, and we need also to include this as part of our undergraduate and graduate teaching activities. I mean, the fact that we need to specifically address vulnerable populations, the role of social determinants of health, that's something that should be integral in our teaching in medicine and psychology, in nursing. I mean, these are things that needs to be. We want to have an impact in practice. We need to train those that are going to be responsible of implementing these tools from the beginning. I want to highlight what I commented before. I mean that these vulnerability factors, these social determinants are important for health and mental health, physical and mental health problems. Not only because comorbidity, it's because the social determinants are key factors in morbidity and health outcomes, and also, as we we mentioned on the uptake of interventions. And this is something that we should take that into account. And also we need to take into account a population level perspective, not trying to assess what's the impact at the individual level, but also at the population level, because we need to reach interventions that try to cover those that are affected in the population, and that will, of course, include the vulnerable population. With that, also other reflections to make an introduction to the debate that will be followed by the different speakers. Thank you very much, Benedict. To you back.
Thank you very much, Jose Luis. That is a very insightful speech, and it sets a bit the stage of our discussion today. No, you gave a very holistic, almost holistic and macroscopic view on the possible problems to implement more interventions, no, in our community. But as well, our projects are kind of hope, no, that we will get closer to that, especially with a clinical impact, what you mentioned as well. I think that's very important. So many thanks for this. And now we will move on to our very nice lightning talks. And this is like each project representative will share now their target vulnerable groups and discuss why they believe it is important to involve mental health research. Before that, I encourage all participants to join the discussion through the Zoom question and answer tool. This is important, okay? And if organizers are okay, we will start with the first project representative, which is Advance. And this is Maria Martí Castañé. Please welcome her and the project. And Maria, would be great if you just can introduce yourself briefly with your role as well in the project, and share with us which vulnerable groups your project focuses on, and why do you consider engaging these groups important in the process of planning and implementing your project. So Maria, it's your floor.
Hi, everyone, and thank you for the invitation, and thank you for organizing this. My name is Maria Martí Castañé. I'm a Catalan in Denmark. I'm a clinical psychologist and associate professor at the Public Health Department at the University of Copenhagen, and I'm here representing Advance. I'm part of one of the work packages that focuses on how to embed interventions that focus on mental health prevention and promotion within social organizations working with migrants in Denmark. But Advance is a very wide collaboration. There's a lot of different colleagues in different countries, and we do focus on different groups that are put in vulnerable positions or situations. And that is, for example, in Germany, we work with youth affected by climate change. In Lithuania, we work with socioeconomically disadvantaged young adults. In the Netherlands, we work with adults that are working in highly, often stressful, digitalized work environments. In Italy and Denmark, we work with people with migrant backgrounds. And in Switzerland, we work with older adults. And I would like to emphasize that in Advance, our take on these vulnerable groups is more that often some of these groups we know that are put in vulnerable positions based on their background, their position, who they are, the experiences they have, and that in some cases they have not been necessarily part of this development of interventions or strategies that focus on promoting mental health and that focus on mental health prevention. So a big part of our project has been to engage in these different co-creation or participatory processes involving the different groups in each of the countries to really think about how we can take some interventions that have been or that have shown some effectiveness, like some WHO interventions that we are working with, and how we can sort of like adapt these interventions, but also adapt the way in which we implement them to reach out to these groups that we know sometimes experience gaps or barriers to access mental health prevention interventions that focuses on preventing mental health disorders and promoting mental health. So again, we are both, working with different groups, but also very much focusing on these co-development approaches to understand their specific needs. And I'll talk later specifically about people with migrant backgrounds, because that is my work package and what I'm focusing on. So I'll give you a bit more of information or insights later in the discussion. Thank you.
Thank you very much, Maria. Great summary of your project Advance, and really including a lot of potential vulnerable groups in your project. So as we want to keep strict to the time, we continue now with the ASPbelong project, and this will be presented by Valeria Motta. And I also, if I could ask you, Valeria, if you just can briefly present yourself, the role in the project with the same questions, basically, which are your vulnerable groups and what did you think is considering important engaging these groups in the process of planning and implementing the project? So many things, Valeria.
Thank you, Benedict. Hi, everyone. My name is Valeria Motta. I'm a postdoctoral researcher at the University of Birmingham, and my work with vulnerable groups is part of a project called ASPbelong. ASP stands for Augmented Social Play, and we are a collaborative initiative that involves partners from 5 different countries across Europe. Our project wants to develop an experience of play for young people with the goal of enhancing their sense of belonging. So the groups we engage with and the work we do with them are deeply connected to the nature of the project itself. And what do I mean by this? Well, research has shown that health-related interventions often struggle to reach young people in particular, because they may perceive them as irrelevant or overly structured or simply disconnected from their lived experiences. So since choice is a defining feature of play, in other words, play cannot be imposed, one of the key challenges that we identified is how to make the experience engaging. And this is particularly relevant when working with vulnerable groups, which, as you know, may have experienced exclusion or disempowerment, in other aspects of their lives. So the simplest answer to why we consider it essential to engage young people is because young people are the experts on their own experience. And if we want to design something that's engaging and meaningful, and especially a play experience that's engaging and meaningful, and that fosters belonging, it must reflect their realities, it must reflect their interests, and also their perspectives. So we think their voices must shape both the design and the narrative of the game. What we can say about vulnerability, and how we'll talk more about this later, I'm sure, but we consider that all young people experience some sort of vulnerability. But there are specific groups whose experiences we particularly want to incorporate in our research, because we want to ensure that it's inclusive. And for that, we develop a 3-step selection process. So this is maybe a particularity that our project has. So we have talked to young people themselves, and we ask them what their experience of vulnerability is, the one that they experience themselves, and also the one that they observe in others. We have also inquired professionals working with young people, just to make sure that they provide additional insights. And also we have asked in the selection process our research team, because we bring our own expertise, and we also want to make sure that we design something that's meaningful but also feasible. So the groups that we selected we selected them because of the vulnerabilities they have are very much related to challenges in belonging that our experience of play can target. I don't want to extend myself too much, but we have 6 different groups that involve groups of refugees, young people with neurodiverse abilities, people with in the LGBTQ plus community, high performance sport players. And in different countries, we have one of the countries we're working with young people who have repeated a year at school, and they have been behind in a year. So yeah, I'll talk more about this later, but thank you. That was me.
Okay, thank you so much, Valeria. So that's the focus really on the young people, but then within the young people, it's very diverse as well, the focus of your project. So that's very stimulating and interesting, I think. And obviously the youngsters are our focus, and we have to see what we can do to include them more in research. Thank you very much, Valeria. So we go on now with BootStRaP, and I think Ella Schalterby will present this project. So the same, Ella, if you don't mind, just to present yourself briefly and then focus on the questions. Many thanks.
Thank you, Benedict. So my name is Ella Shaltawi. I'm the Youth Engagement Lead at Euro Youth Mental Health, which is a charity working within the BootStRaP project. So first, I'm just going to talk a little bit about the term vulnerable, and then I'll talk a bit about what we're doing as a project as well. So I think the term vulnerable can be problematic because it's such a wide catch-all term, and that can encapsulate stigmatized or racialized views. And I think in this case, what we're really referring to is the intersection identities of the people we're working with. And so it's more helpful to be specific about who that group is at the time, as opposed to giving sort of potentially othering terms that are generalized. So, for example, talking about populations with lived experience in a certain issue, or where this is not possible, switching up the term for something that is less alienating, so puts the emphasis less on the individual and more on the systems. So things like priority communities, I think, can be helpful as well. Certainly within the BootStRaP study, we're engaging with young people with lived experience of mental health problems, as well as young people with experience using the internet for specific reasons like gaming or running YouTube channels, and we're working with them as co-creators. And we're also working with young people from the ages of 13 to 15 through their schools. And this is because the study is looking into problematic internet usage and digitalization. I personally see young people more as stakeholders in this study, particularly when it comes to work on policy, which is something we're doing towards the latter part. They bring a really unique perspective as digital natives. A lot of us don't bring that, but they do. So it's really valuable to have their opinions. I think making that space at the table, in this case for young people, and acknowledging that that's going to have implications for funding and timescales, which I can talk about a bit more later, is really important because it prioritizes equity as well. It helps us make the study more relevant, keeps it realistic and impactful, particularly when we're developing interventions. Certainly, I also think it's empowering for young people, and it gives agency, in this case, for them to be part of their own future. Within the youth work community, we often say nothing about me without me, and I think it begs the question why we wouldn't include key interest groups in the first place, particularly when we're developing health-related interventions. So yeah, we definitely see a really valuable role in terms of making that research relevant.
Okay, great. Thank you, Ella. So it seems to me the co-creator aspect is very important in your project, to include them actively. Because if you're not agreeing, it will be very hard to perform whatever project, I suppose. No, thanks very much. So we go to the next project, which is Improva. And Improva will be presented by Esther. So Esther, the same to you. Could you briefly present yourself and then focus on the 2 questions?
Yes, thank you so
for
much.
the audience. Thanks.
Thanks. I am Hester Seidsma and I work as a postdoc researcher at the Vrije Universiteit in Amsterdam. And I work for the project Improva, in which we created an e-health platform to improve mental well-being for adolescents. And we aim to reach adolescents in a general population, mostly via schools, meaning that we're also in touch with adolescents' parents and teachers. And this also means that our strategies need to be adapted to each of these target groups. So we need to think about why it is useful for adolescents, for schools, for individual teachers, for parents to participate in such an intervention. And I think we need to make explicit, like, what can these different groups gain from an intervention, and what can we offer them. And we need to think about what it means for these groups, especially for adolescents, to participate in the intervention, and therefore it's required to also engage them in the different stages of the process. In my experience, schools get many requests to participate in research and in different programs and in different interventions. And of course, they have other priorities to fulfill. So reaching adolescents via schools can be quite challenging, but they can also help you and provide you with useful information. And I think we need to pay attention to engaging adolescents and really explaining to them what an intervention means, what research is, how they can contribute, how they can profit from participating in an intervention, because that's quite often unknown to them, and sometimes the benefits are also not very concrete. In this sense, co-creation is increasingly getting more attention to ultimately learn from the different stakeholder groups how to connect and how to engage them to reach better results. Because we can learn from them like about the appropriateness or the feasibility of, in our case, a prevention program. And they can also inform you about important facilitators and barriers to implement such an intervention. One final note that I really notice is that it is important but also quite challenging to reach schools and adolescents and parents from various representative groups in society. So in my experiences, schools and adolescents from higher socioeconomic backgrounds find scientific projects interesting and see ways how interventions and science can help them or how they can offer something to science. But only recruiting adolescents from higher socioeconomic backgrounds results in a biased sample, and we really face the consequence that findings cannot be generalized to the entire population. So that makes it, in my opinion, even more important to reach and engage people from various socioeconomic backgrounds. Thank you.
Thank you so much, Esther. That's a big problem, how to get to those population disadvantaged economic areas. That's really... So your focus as well on youngsters in school, including parents and professors. That's great.
Yes, indeed.
Okay, great. Thanks so much, Esther. So we continue with Mentbest, our own project, and I'm very happy to present you Daniela Gatto, but you will present yourself, Daniela, and also please focus on the two important topics.
Many thanks, Benedict. Good morning, everyone. I'm so sorry for my camera. I think that I'm having some issues with the PC.
It's half blue, actually. It's half blue.
Yeah, I'm blue, so I'm really so sorry. I will try to resolve them, but
yeah, no problem, no problem.
Yeah.
Yeah.
So, good morning. My name is Daniela Gatto. I am a psychiatrist, and I'm part of the Mentbest project. I work actually in the work package that is on charge of the coordinating activities here in Spain, but and the other 4 countries that are involved in the project too. There are Estonia, Greece, Ireland, Albania. I would like to make a brief presentation of Mentbest. Mentbest is a project based on community interventions. Aimed at the early detection and prevention of depression with the ultimate goal of reducing suicidal behavior. So really for this reason, it's crucial to reach into the entire community with a special focus on those who are specific needs or who are in vulnerable situations. We actually have 5 vulnerable groups: young people, older people, migrants, unemployment, people with mental health conditions. So we believe that it's essential to reach these groups because they are an integral part of the community, of course. So to truly measure the impact of our interventions, we really must address their specific needs. And additional, I would like to mention that we know, to base it on the research, that these groups have a higher tendency to experience mental distress or even develop mental health conditions due to different factors, of course. So for this is another reason, because we need that. It's very important to read into them. So many thanks for being here today. I hope that you can enjoy this webinar.
Okay, thank you, Daniela. People commented it's a very cool filter you have, the blue filter. So thanks for that. Despite the technological problem, just to give a brief and good overview of our project, Mentbest, where we try to include really a whole spectrum of vulnerable groups, which is good, but also very challenging. So thanks for that. We continue with the project now, Reconnected. And I think Minja Westerlund, hello.
Hello.
You will present yourself as well, Minja, and just focus on the 2 issues again, please. Thanks.
Thank you. Thank you for having me. It's very good to be part of this panel. My name is Minja Westerlund, and I'm a psychologist and senior researcher based at the University of Turku, the Department of Child Psychiatry Research. And we are representing the Reconnected project, which is a project in 9 countries across Europe, with the aim to develop a digital support system for resilience for different vulnerable groups in Europe. And as for myself, I've always worked either in research or in clinical work. A large part of my career has been dedicated to the humanitarian sector. So the question about reaching vulnerable groups has been something that I have worked with for a great part of my career, and continue to do so now within the research sector. In our project, we decided to focus on the mental health of young people. It's a very topical issue. We have all heard almost on a global scale how youth mental health has been declining, reaching a very dangerous phase. And there are many different global megatrends that have been linked to this phenomenon. Our inactivity on climate change, the adversities linked to the COVID pandemic, different wars and conflicts, financial insecurity, financial inequality. And so these are obviously huge stressors that are affecting everybody, but a great deal also young people. And as in many countries here in Finland, we can almost talk about the public health crisis when it comes to youth mental health. And we see needs are increasing, but the services are quite spread thin. And in this project, we chose to focus specifically on 18 to 20-year-old young adults, because this is a transition period in life which comes with a lot of challenges, a lot of joys, of course, but also big changes, big challenges. It's a transition from adolescence to independent life. Many young people start their studies, and we know in Finland that mental health problems are actually higher in students than in the general population. More than a third of students are not happy with their mental health. And another important factor in this population in Finland is a particularity of our country, which is the military service. We have maintained our conscription model in contrast to most European countries. We have maintained it because of historical geopolitical reasons. So every Finnish man is liable for military service. It's voluntary for women, but we know also that the dropout rate, even if it has been declining, it's quite high, and mental health reasons are quite overrepresented among the reasons to drop out. So we know from a lot of research that youth mental health is in crisis, but the young people themselves have not been much involved in this research. And we think this Reconnected project is a great opportunity to do so, because to address these problems, we need to, of course, understand what problems, what stressors young people are experiencing, how they look like. Of course, the group of young people is very diverse. And we need to really understand the realities where young people live. And we as researchers should not be steering these research questions a lot, but give the floor to young people so we know how to ask the right questions and not neglect important areas. And also, when we then go into developing interventions, it's crucial that we include the users, the young people, in developing those, in addition to professionals with expertise in youth's mental health, because it's only the young people who can tell us what can make these interventions meaningful, what kind of content is needed, what kind of language they can relate to, what format should it be delivered. And of course, if we don't adapt our research to the user group, to young people, of course, it will have many negative implications, both for the research, but also for the usefulness of the interventions that we are developing. And I always like to link this to clinical care. So also in clinical care, we should use empirically supported interventions, but always adapt them to the needs of the user and the preferences of the user. And that is actually what constitutes in evidence-based care. So I think these principles should always be considered in the research world as well. Thanks.
Okay, Mija, many thanks. Also a project, I understood, for youngsters, but older youngsters between 18 and 20, and like a digital intervention to increase resilience, in a stressful environment. So that's also very interesting and relevant. And now we come to our last project, which is SMILE. Sounds very positive. And this will be presented by Gwendoline Meyer from Germany. So Gwendoline, maybe you present yourself as well briefly, and then focus on the two major issues of these discussions. Many thanks.
Yeah. Thank you. Thank you, Benedict, and thank you all for inviting me to present the project here. My name is Gwen. I'm a psychologist at the Department of General Internal Medicine and Psychosomatics at the Heidelberg University Hospital. And my research is on digital health interventions in psychosomatic disorders and especially mental health disorders, and on understanding the social environment and social networks, physical and the digital social environment of patients with mental disorders. And in this SMILE project, we are closely working together with the child and adolescent psychiatry in Heidelberg, and we are leading the work package 7, which is on piloting and evaluation of the SMILE tools that will be developed. So what is the project about? We are concerned with a group of adolescents. And what do we mean by that? We are guided by the definition of the WHO of early, middle, and late adolescence, and including as well the young adults. So more specifically, the age group 10 to 24 years old, which is a quite big age group and a quite wide definition here. But this lifespan is particularly formative for the emotional health of the whole life. young people are confronted with themselves and their social environment, make their first critical experiences, define themselves, form an identity, and seek a place in the world. And both successes and setbacks are experienced very intensively and can have a lasting impact on the later life and on life decisions. And it's therefore not surprising that mental stress is common during this time. It's estimated that around 1 in 7 adolescents experience a mental illness. And this number does not even include those who might never seek help or might never go to a formal institution with their problems. And research has shown that the onset of many mental disorders has become earlier in the past decades. That means that people with the diagnosis get younger, especially for example, in eating disorders. And finally, it's important to mention that suicide is the third most common cause of death as well in this age group. In our project, it's about meeting the group where they already are anyway in the digital world. And this constitutes a stressor in itself, but more specifically in gaming. So that's why my project is about developing a mobile game that addresses mental health issues. It's embedded in an adventure story of around 5 modules and chapters where the users are provided with concrete strategies that are taught on how to deal with oneself, how to build resilience strategy, how to form healthy coping strategies. And our methods, we borrow them from cognitive behavioral therapy concepts, although the game itself is no therapeutic game. So we are not intending to heal people with a game, of course. This would be really too much. And we believe that technology will never replace a real face-to-face human encounter. Rather, it's a preventive game. And we decided as well not to focus too much on patients. We want to focus on the broad community of adolescents and to reach really the adolescents and their daily life and their day-to-day challenging situations. Yes, but the topic anyway is accompanied by strong fears and reservations, for example, due to this stigmatization. And that's why we involve young people early on in the development of the concept. I think the other projects as well focused on co-creation. That's what we did as well. And yeah, we invited people to participate in workshops and in focus group discussions within their respective age groups, which are 10 to 14, 15 to 19, and 20 to 24, to keep in a safe space within their own age groups. And finally, it's important for us as well to listen to the stakeholders, so to understand the perspective of parents and teachers and clinicians as well. Where we currently are in the project, we are in the middle, I think, as all projects that are presenting here. Our workshops and focus groups took place, but we are just before a huge testing phase of piloting and testing the Smile game and the so-called companion app in 7 countries, in Cyprus, Germany, Italy, Poland, Slovenia, Spain, and in UK. And yeah, this will be exciting. It will start quite soon, and happy to talk more about the challenges a bit later in the discussion. Thanks.
Okay, great. Thanks, Gwen. Thanks a lot. Also, thanks that we kept quite well to the time of all projects. So again, youngsters, co-creators as well, a lot of implication, active implication, and digital tool as well for them. Great, thanks. So thanks to all the panelists. Engaging these groups in research obviously is fundamental for ensuring that the outcomes of our strategies are meaningful for the community. The involvement is crucial for making our efforts impactful. The clinical impact is is really very, very important, as stressed before by José Luis as well. So now, because of time, we have to speed up a little bit. We will transit to our moderated discussion, and I'll be posing questions to our panelists, and we encourage an open dialogue between them. And I think, if I understood Carrie, because of time delay, we can, the participants of the whole webinar, they can add their comments as well in the question and answer area. So let's begin with our first topic. We have 10 minutes per question, engaging with young people in research, challenges, and solutions. Young people is obviously on focus of many projects here, of almost all, and engaging young people in health-related intervention can be hard, and they need specific consideration. What challenges has your project identified, and what solutions are you implementing to reach young people? So here I would like that BootStRaP, Improva, Reconnected, and Smile give their corresponding answers, please.
Well, I'm happy to speak and start for BootStRaP.
Exactly, yes, Ella, please.
I think one of the
BootStRaP?
BootStRaP, yeah. I think one of the challenges for us is engaging with a diverse group of young people from a diverse, socioeconomic groups, and that bring a range of lived experiences, especially because the BootStRaP project is recruiting from across Europe. So we're engaging with young people on different levels, some in a more youth advisory board capacity, and some within schools, and recruiting from 14 different schools. So the way we've combated this is really to sort of utilize our links and try and be proactive in connecting with communities. So through youth groups or through schools, in order to build those relationships. But it certainly takes time, and I would love to hear, from other projects as well, if that's something that's come up for them.
Yes, I can continue. I think we have also more challenges than we have solutions, but maybe by the end of today I can take home with me more solutions from all of you. I agree that often when we want to engage with vulnerable groups, in our case young people, starting to build this relationship is very important. Of course, depending on what kind of research we do we do qualitative interviews or surveys or whatnot? But basically, you have to, in some way, try to make yourself and your project relatable to the target group. One thing that maybe is not discussed so much, but which I have come across especially when dealing with more marginalized youth. Again, the group young people is very, very large and very diverse, but sometimes we may want to target more marginalized people. And a challenge there can be that this group may feel quite alienated from the society and may see you as a sort of representative of a system that has failed them. So there you have a challenge to begin with, that how do I come across this barrier? And of course, as a psychologist, I always say my answers always start with "it depends," but it depends again. How do you manage to create that dialogue with them to validate their experience and make them feel heard without patronizing them? This is, of course, easier to do when you do interview studies, but I can think also it can be done even if you do an electronic survey, by the language you use, the content that you use, when it has been adapted well enough to the group.
Yes, I can definitely relate to what Mia says. I think we in Improva don't really target marginalized groups, but already I think reaching adolescents from general population and also schools, like you really need to invest in building a relationship, have clear communication, and it really takes time to build that relationship, that they get to know you, what your goals are, why you're reaching out to them. And also, I think really also what Ella said, like reaching diverse groups. I think we are trying to really pay attention to explaining and adjusting the language, and really try to step in their shoes. Like they probably are not familiar with research or interventions, and really try to adjust your language and involve them. But I agree, it's really already hard to reach them and to get them on board. It's a challenge.
Yes.
Okay.
Regarding language in our project, so the most challenging thing for me was writing the information sheets and the consent forms and explaining privacy to 10 years old, because our ethical commission was quite strict here. They told me all the time, you have to write this you have to write this in a way that 10 years old might understand you. And in the end, we used as well visualizations for it. So what is personal data? So, and in which kind can you say no to things? So, and this is, I think, a main issue, that to inform people, the adolescents, what do they have to join if they want to participate. But there in our project, we have some functionalities. They can, of course, they can say no. They can say, I don't want this. For example, a video diary, this is more innovative and experimental, and if they don't like it, then they can just refuse to do it. And from my perspective, the hardest group was the middle group. So the kids were not that dramatic. They were quite engaged. They really liked it, and yeah, they were fascinated. And the young adults were quite interested, but the 15 to 19 years old, with our very first focus groups, we got, I think, 30 or 40 email addresses that they are interested. And in the end, we had one really signature. And then we said we will come anyway and do this focus group. And 10 of them then joined. So it seemed a little bit like they just wanted to be sure what the others do. So are my classmates joining or not? And this will be a problem in the end, because, yeah, we have to. I don't yet have a solution for this, but I think a major strategy will be just to be a bit more trustful and just proceed.
So it's not easy. It's not an easy task. But if we can create confidence, if we relate to them in a good way, if we adapt our language to them so that they can get closer to us and build a relationship, it is easy. I think this is a little bit the summary of all what you stated so far. Okay, great. So if you agree, we move on to the next question, which is this is for advance, ASPbelong and Mentbest, and reaching other vulnerable groups and engaging them in research. So I would like to hear your impression about how did you decide with which groups were important to target actually in the grant application, and what strategies have you designed to engage them in research? So now we are leaving youngsters and we go to other vulnerable groups. So if you're advanced, Maria, if maybe you start.
Yeah, sure. So I can tell you a little bit about the strategy we've been using across all the projects, but perhaps especially working with migrant groups, how that played out in our study. And what we've been doing is engaging with society advisory groups. And these are groups of stakeholders that also include people with lived experience. So in our case, it included both, different organizations that were working with people that have migrant backgrounds in Denmark, from NGOs providing all sorts of social care to representatives of the government and integration services. And then we also invited 3 people that had migrant background and that could relate to the topics of mental health. And then another important sort of like method that we've been using is that we have been facilitating these encounters with the social advisory groups with a co-facilitator that is here today. I can see her name, that is also from a migrant community, or she also has a migrant background herself. And I think that's been key actually to bring a different perspective to the kind of questions that we've been asking. And balance also this, power between the researchers and someone that has themselves background similar to the groups we are aiming to work with. And I think that working with this Society Advisory Board opened up and shaped actually the groups that we then decided to work with. And just to give you a very practical example, originally in the grant, we thought that we were going to integrate some of these stress management interventions developed by WHO within integration activities like language schools and job centers for migrants, and specifically for newly arrived refugees. But then when we had all these meetings with the Society Advisory Board, it became very clear that aligning with what it's seen as the integration services that put pressure on migrants was not going to work. We were not going to gain trust doing that. So we changed our strategy. And also it opened up to actually identify other groups of people or communities that have migrant backgrounds that have been paid or that have been marginalized even more. So instead of, for example, focusing on refugees, we open it up and we broaden up the group to anyone with migrant background, but specifically working with social organizations that are providing care. And I think that's been the second strategy that has been really, really important, that we've been working very, very closely with a social organization that we know well, that we're very much invested and engaged and interested in the project, and that through them, we've been able to sort of like slowly follow their pace and their recommendations to engage with their different groups. And that has also required some flexibility. Sometimes research that's not allowed for that. And I think that if you really want to engage with groups that have been marginalized, you really need to think differently, and perhaps, research-wise and methodologically wise, we be way more flexible to make sure that you engage with those groups that are often not part of these conversations and discussions. And then the last point, it's been also about stigma. And again, here we're talking about vulnerable groups, but we never say vulnerable groups when we go and talk with our partners. We talk about people that have been either put in marginalized positions or that are experiencing a lot of structural injustices, as that also removes this stigma to the individual. So this would be our sort of like take-home messages so far.
Great, thanks, Maria. ASPbelong.
Hi, well,
Valeria.
yes, hi. Thank you. There are lots of things that were said that I can relate to, and I think one of them is recognizing that there are different modes of communication. So with the different stakeholders, with the different groups, because we're working with many different marginalized groups, the difference in communication with them, the modes that we need to adapt our language, they're not the same for all the groups. They're different, and also the ways of reaching out to them have been we have had to develop new strategies. So in that sense, our openness to adapt our methods to their needs is really important. The openness and yeah, so for us researchers, that's very challenging, because we think we know what methodologies we should be using, and we would like them to work, but when they don't adapt to these groups, that's when the challenge comes. And also to make sure, I think that something that has helped us be more welcoming to these changes that we've had to make is that if we really want our participants, our co-researchers, because we engage them in different levels, right? So we think that participant is one term in one type of way of asking questions, engaging with them, and co-research is another level of participation. So we're very aware that these are two different levels of engagement, and to make sure that we're giving them choice, we need to communicate in an appropriate way. that's one of the things. And then the other thing that I very much related to with regards to what was said, what Maria said, what Gwendolyn said, is vulnerability. We had to, and we wanted to drop that label, and we're not just using this as a category to describe these groups. We're using this vulnerability as a guiding principle for our research. So what this means is that the more we know about what these groups need, the more we can adapt to their needs without having the more we can adapt the methodologies that we use to the needs they have. So if we want them to be able to collaborate with us, then one group will have a different need than another group, and that's what we're thinking. That's what we're incorporating. Yes, maybe that's
Okay, great. Many thanks, Valeria. Daniela?
Thanks. As I mentioned before, we have 5 vulnerable groups in Mentbest. So we are working in order to adapt all the strategies and materials for these groups. I would like to mention some things about migrants and other groups too. But for example, here in Spain and in the rest of the countries, of course, we were working in the adaptation of the materials. We have different community interventions, community activities. So public campaigns, for example, are part of the community interventions. So we have different material like posters, flyers, leaflets, etc. The idea was, one of the challenges first was the translation of all these materials in different languages. So we had to identify what were the most prevalent migrants communities in each country. So in order to this, we did the translation of the materials, but of course the translation itself was not enough. So because the next step was the cultural adaptation, and I think that this part is the most challenging part, because of course it's not the same the way that different migrants communities see, or the conception that they have about mental health, talking about, for example, suicide. So this part of the work, I think that was the most challenging work. Try to reach into them, to give the message, psychoeducational messages, etc., but try to be very respectful with their cultural needs. Another point, the last point that I would like to mention is that as part of the project, we are working too with the stakeholders. Valeria, I think that is very important, this part of the work with the stakeholders, because at this level, we can see the real world. And we try to target different stakeholders that work, for example, for migrants, for young people. So we offer them trainings, and through these trainings, we are giving them skills and strategies in order that they can identify mental distress in each vulnerable group. They can to accompany these vulnerable groups in the moments of acute distress. So yeah, I think that this is the most general and important overview of all the work that we are doing. Thanks.
Okay, many things. I don't know, Carrie, if we have any time to include some comments from the question and answer tool.
Yes, we still have time, so we can, if you want, we can go to the next section, and if we finish by maybe 12, we will still have a couple of minutes to answer some questions from our attendees.
Okay, so many thanks. Great perspectives, everyone. Nice discussion. And our final discussion point addresses an essential aspect now in order to reach vulnerable groups. For me, very central. We had to change the last years and to include more our in-person, the really affected person, And what we would like, we have now 10 minutes to comment about the role of peer-to-peer engagement, collaborating with people with lived experiences of mental health conditions. And I think we all agree here. I mean, this was one of the essences already now, that co-creation is very important. We need to know what they want, what they feel like. So I think it's very meaningful to adapt our strategies to the needs, real needs, what they have. So we hear from two persons now with lived experience involved in the Mentbest project and also in the BootStRaP project. And maybe we start with BootStRaP. And I can invite now Ella again, who is the youth engagement lead at the Euro Youth Mental Health, a dedicated facilitator and youth worker. And maybe you can bring, with your extensive experience in mental health inpatient settings, hospital, schools, and residential care, your opinion now in place.
Sure, thanks, Benedict. I think meaningful engagement and is really about ensuring you're willing to hear all the different voices in the room. And this takes commitment at several levels, and then I'll focus a little bit on the peer-led spaces. I think it's partly about changing attitudes, so committing to doing the work within the whole study or system with people who may not be used to co-creation and might need upskilling on the value of this. So making sure that when we are working with these vulnerable or with these young people's groups, that their experience really reflects that. And so allowing time for meaningful change. And if you're going to listen to all the voices in the room, that is going to take more time. So yeah, factoring that time in, and the fact that that also means money as well. And I think another really key point is including young people as active participants as early as possible in the research process. So when we're making these big decisions and shaping the initial research and what we're researching into, because that changes absolutely how invested they are and how much the buy-in is. And I think when we're thinking about peer-led spaces as well, it's really about prioritizing the support of individuals, so recognizing that those young people might need more time or more support in order to access that study, and this is really about relationship building in order to give that time to check in, to see if there's any needs that they might have, anything within their own, how they would explain that, giving them the sort of space to say, what do you need in order to access this and how can we help? And then fitting in on their terms. And I think at Euro Youth, because we're a majority volunteer organisation and we're really structured about peer-led support and spaces, we've done that on a couple of levels. So we have peer-led spaces anyway, where young people can meet and can talk about mental health and bring whatever issues they like, if it's something small or something larger. But we also have, within the BootStRaP project, have had peer facilitator roles, which are young people that have some more paid time on the project to be able to lead youth spaces. So when we've been doing some of that research and evaluation and having those conversations, they can also be led by young people and shaped by young people, and we'll plan those sessions with the young people as well, which I think really changes the conversation and the buy-in that you get, because it's a peer-shaped space. Yeah, so that would be my thoughts on it. It's including young people as much as you can in the process, and remunerating and recognizing that commitment.
Okay, great. Thanks, Ella. So we listen, we try to adapt our attitude, we change attitude, and we include the people at the earlier stage when we write our grant. So when we apply for our grant, to get in their opinion. Okay, great. Thanks. That's very helpful. Now a big welcome to Carmen Llanes. She's our Mentbest star. Basically, she is everywhere. She's always involved in all our activities. So we are very grateful, Carmen, again, to have you here as well. And she's a peer-to-peer support worker and one of our co-creators of Mentbest, very passionate about mental health advocacy. and she plays a key role in fostering support networks and empowering individuals through lived experiences. I saw her many times, always fascinating. Please, your floor, Carmen, to bring up your mind about this topic today.
Okay, thank you. But I'm a little bit nervous, and after Ella, my English is not very good. So first of all, sorry for my English. It's my first time in talking in English, so let's do it.
Don't worry, Carmen. Just
okay.
good.
I made a training as peer-to-peer 3 years ago. Peer-to-peer is the person who supports an unequal in their recovery. It's very important to have a bond or link, I don't know how do you say, because when it happens, the recovery happens. I give speeches to the students in the high schools as well in the university with the goal to normalize and to normalize the mental health and fight against the stigma. As a co-creator of Mentbest, I have collaborated with sharing my point of view from first-hand experience in the field of mental health reach. This work has not only improved my well-being as and the self-esteem. I also believe that I can offer my genuine perspective and how to connect with more deeply with people who have mental health conditions. The most important challenge for me was getting accepted as a peer-to-peer in the mental health field, because it's a pity, but sometimes people don't believe that we can help. When I say we, I mean people with, for instance, with depression, we can help others. Other challenge I've faced is, we're dealing with the stigma, different levels of understanding about mental health, and making spaces where people feel comfortable sharing their experience. I believe that sharing my own experience with others and helping with in the project, for instance, doing the posters, the flyers about depression, add something extra. And finally, I'm still realize that all that has a positive impact into people above all the people who's passing through mental distress or they have a diagnosis. Because when we talk, when we are close them, they realize that they are not alone. They are not so weird as they think, and they can see a light at the end of the tunnel, that the recovery is possible because I'm an example. So that's all. Thank you very much.
Thank you so much, Carmen. Your English was wonderful. Many thanks. And the content, obviously, very important. So thank you to all your contributions. If it's okay, Carrie, I would like to include just 2 questions from the audience. One would be from Ellen, and for you to discuss this or answer, are any of the projects involving influencers, e.g. from TikTok, as ambassadors to promote mental health, life skills, etc.? Okay, Minja.
Well, here, this is a good example on how our stakeholder panel was very important for this project, because actually involving influencers for the dissemination of the intervention. There was one young stakeholder representative who said that this could be a good idea, because influencers are people that many young people listen to, and they already have a relationship to them because they follow them on a daily basis, and they are people who they listen to. And this is an idea that I myself would maybe not have come up with. So we may do that in the future when it comes time for dissemination.
Thanks, Minja. Anybody else? We in Spain, we did so as well in one of our activities. Daniela, do you want to comment on that?
Yeah. Totally, I was thinking the same. We have an event. It was one of the first events of the community intervention for young people. We have Paula Goyante that here. She's very popular. She's an influencer for young people, and it was very interesting because even during the event, the young people was so interesting. They did a lot of questions to Paula. They looked so engagement into the activity. So really was very, very interesting to have the opportunity to have her into the intervention.
Okay. So the next question would be from Roberto in Spain. Do you follow if they exist established or official guidance on how to involve these groups in the design of studies or the adaptation of interventions? Daniela?
No, my answer is I think that not, and if it exists, I don't have the knowledge about it, but I think that it could be very useful. Yeah, this is my answer.
When?
Yeah, it would be an idea to develop these kind of guidance after completion of our old project. Maybe find some synergies or some results. Would be really an interesting approach. And I already tried to answer this in the Q&A chat. So you will find much guidance in the literature when you look for living lab methodology or co-creation. These are big keywords, but I think there is some guidance, but there will never be a standardized checklist because this is so individual, and yeah, this is not realistic.
Okay. Ella, last comment?
Yeah, I would add to that and agree with sort of what Daniela and Gwendolyn have said, is that there isn't a standardized procedure. And I think with evaluation, that literature is still growing. But certainly from our perspective at Euro Youth, that can be the benefit of working with existing structures. So in our case, we're already a mental health youth organisation. But if you're trying to work with a group that you're already struggling to contact, there might be youth groups, or there might be groups that work with that particular community out there that can help you really connect with them more, because they might already have lived experience within them and relationships with those communities, and they can work with you to sort of collaborate.
Okay, great. So we are arriving already to the end of this webinar, which was fantastic. I think very interactive, very stimulating. Thanks to all of you for your thoughts and questions and contributions today. We really appreciate, obviously, your participation in this dialogue, all the people who were there as well participating in this. Maybe just I can summarize some thoughts, what I thought was really interesting and stable through our discussion on this webinar. One is that obviously in all 7 projects, there's a focus on youngsters. They are important because of many reasons, but because of preventive reasons as well. We have a wave of mental health. We have to see that this wave doesn't get too big, at least. We adapt on them. We create good relationship with them to get them into the boat. We are flexible with immigrants. We try to be not too scientific, basically. And we try to offer also more personalized interventions. What Valeria said, they are really splitting up their intervention within their youngsters, which is interesting, I think. And one thing we learned today is that we do not mention too much vulnerability because it's stigmatizing. So we try to avoid this. We have, obviously, especially with immigrants, language problem. This is why we had to translate in our project Mentbest this in many, many languages. And we are still in the process actually to review all of them. but a big challenge is the cultural adaptation. Still, how do we understand their cultural background? How do we get close to them? And we try to change our attitude, listening, and what Ella said, include them as early as possible in our project. This is very vital. And obviously, Carmen, it's important that your work, peer-to-peer work, is extremely important. And I think, yes, you really can help. You know, we are convinced in our mental health institution that you really actively help other people affected. So this is just to finish. We still have 2 minutes. If there's anybody else wanting to add something further, you're very welcome. If not, we can actually conclude this seminar. Many thanks again for participating, the panelists, the peer-to-peer experts, and Karen and all, many thanks for the great, fantastic organization of Jose Miguel as well. Many thanks.